Welcome to Brain Chat with the Nerdy Neurologist. I'm Dr. Mitzi Joi Williams, and I'm your board-certified neurologist and MS specialist. My mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be talking all things MS, health and wellness, advocacy, and we'll throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Happy Monday and welcome to Brain Chat. I hope that everyone had a wonderful Labor Day weekend last weekend, or actually the weekend before. I guess I was on holiday this past weekend. So it's so excited to be back with you guys today and to talk about a topic that is so near and dear to my heart, health equity, with two of my favorite super friends, Dr. Ruth Clements and Dr. Kirk Taylor. So you guys know what we do on Brain Chat. When you come in, let me know where you are logging in from. And while we're doing that, I'm going to just kind of go quickly through the bios of these amazing people. So first, we have Ruth Clements, who is currently the Vice President and General Manager of the Infectious Disease and Immunology franchise at Quest Diagnostics. And she has been instrumental in the COVID-19 response, planning for Quest Diagnostics, and also spearheaded the recently announced Quest for Health Equity Initiative, which I'm excited to hear about that, which is geared towards leveling the playing field for health disparities in underserved populations. Prior to Quest, she was the commercial lead for respiratory at Novartis in the new products business unit and the executive director of neuroscience at Novartis. And she's also served in various roles at Accorda, Bayer, Organon, and Allergan, and she has been a catalyst for change throughout her career, keeping the patient at the center of everything that she does. And it's her passion and strong personal connection with the patient community she serves that allows her to deliver best-in-class programs. So excited. And then we have Dr. Kirk Taylor, who is the Senior Vice President of North American Medical Affairs at EMD Serono, a Merck company, and has a regional revenue greater than 1.4 billion. Leads the medical team in strategy and execution for oncology, neurology, immunology, fertility, and endocrine, and also presents the portfolio plans to board members, external stakeholders, and the C-suite. He's been a senior executive in the pharmaceutical industry for over 24 years and has experience leading global teams, championing late-phase development, and transforming medical departments. He is a neurologist by training, and so has been familiar with MS, and both of these amazing people have been in the MS space for some time. I truly respect them and all the great work that they're doing. So, the topic that I really want to talk about tonight is about health equity, right? And I think that one of the most important things that we recognize is that there are many different roles that different entities play in health equity, that it's not just about the doctor and the patient. We have to broaden our view and broaden our reach and look at how each one of us in each of our spheres can influence and improve health outcomes. And I know that these people are doing the work. So excited to be talking with them tonight. I see I got a couple people logging in from South Jersey. I see Johnson City, Tennessee. I see one of my friends from Albany, Georgia. All right. Thank you guys so much for logging in, Illinois, and I'm sure we'll have more to join. So let me bring up my guests to the stage, Ruth Clements and Kirk Taylor. Welcome to Brain Chat.
Hi,
Thanks
how
for
are you?
having me.
Thank you.
Hi, you are very welcome. I bring the energy. Yes, it's a Monday. It's a Monday night. Listen, we got to pump it up. So I'm so excited to have you guys on tonight. And as I said, I really respect, a lot of the work that you all have been doing. You've been in the neurology, neuroimmunology space for some time. And I think that oftentimes people don't recognize that there is more to health equity than just, the doctor patient relationship or hospital relationship, that when we talk about things like clinical trials, we have to think about our industry partners. We have to think about how we're designing things, and think about things, and renovate our thinking from the ground up. And you guys often have a large hand in helping kind of shape those things, as well as the education that we as physicians are able to provide to the patient community. So I'm so excited. We're going to hop right into it. All right. So first, why don't you guys tell us a little bit kind of about your training and how you got to where you are, right? Working in the industry, working in, marketing, working in, clinical trials development. So tell us a little bit about, we'll start with Ruth and then we'll go to Kirk.
Very well. Very good. Hi, everyone. I'm Ruth Clements. I am a pharmacist by training, so I'm honored that you call me a doctor, but I'm not a doctor. I rolled into the pharmaceutical industry almost immediately and spent a great amount of time in neurology, and that's how, of course, you and I met. And, back in those days, health equity was all around clinical trials, right? And making sure that we had enough representation. Um, it wasn't until I made the transition into diagnostics, working now for Quest Diagnostics, and this pandemic, that really highlighted um, how disproportionately the Black and Brown communities were impacted by COVID-19, as well as the elderly, right? And so and it brought health equity to the forefront. The health equity problem has been there prior to COVID, and it will be there after COVID,
Mm-hmm.
but it elevated it, and it also, in my mind, made it mandatory for us to take action, right? Because health equity to me means that everybody has access to quality care, regardless of what zip code you live in. And what we are seeing in reality is that that's not the case.
Right.
And I think because of that, clinical trials is just one sliver of the cake. But when it comes to overall health and wellness of the underserved communities, there is so much that still needs to change and needs to improve. And that's why I'm so proud, to be part of this Quest for Health Equity initiative that we started at Quest, where the organization really dedicated, significant resources behind an effort to move that needle, in that direction.
Absolutely. Absolutely. Kirk.
Yes, hard to follow that because I totally agree with everything she said. But yeah, so as I said, I'm a neurologist by training, and then uh, stayed in academics for a while, did some specialty pain and headache, as you know, and some EMG work, and then decided what to do with my career, and found that I had a great partnership, or at least love of clinical trials, doing clinical trials, and found a home advisor. So I was there for 12 years, where I did clinical trials. I did late phase development and early phase as well. But also I saw patients. I saw patients on the weekends for 12 years. And so that fulfilled that part. As I rose up to the VP level, I couldn't do both. But I saw through the years, one, the clinic I volunteered in the South Bronx, definitely there was health inequity. I saw what it was like to practice in the academic centers, the centers I visited, the centers I trained in. And then I saw the lack of resources and the kind of buses that came up trying to sell health insurance to the people who didn't know better, but they needed something. So to me, it goes right along with what Ruth was saying. It's, health equity, the opportunity to have access to live the best life, the best, healthiest life possible.
Yeah.
And that is not easy because you know that not everything is equitable and not everyone starts off at the beginning of the race. So I think my journey has certainly shown me where the gaps are, but also what I can do to help change that.
Yeah, and I think that, when we talk about this conversation about health equity, there's so much, right? We could talk for a whole
Yeah.
hour just about health equity. But,
Yeah.
as you said, Ruth, I think the reason that there's such an urgency now is that the pandemic has really shown a light on things that we've known about, right? We've known
Yeah.
that everyone doesn't have equal access to care. We've known that everybody can't get to the doctor, for particularly with MS. We've known that there are certain communities where we see worse outcomes, like African Americans, Hispanic, Latino, also people in rural communities, right?
Yeah.
And we've seen all this stuff, and everybody said we need to do something, we need to do something. But now everybody's like, no, we need to do something right now. So, I mean, it's a good thing, but it's also like, gosh, did it really have to come to a pandemic, right? And over
Yes.
500,000 dead people for us to
Yeah.
finally come to this conclusion to really push forward,
Yeah.
the
But
agenda.
I also think it was more than just the pandemic, right? The pandemic was one thing, but on the other end, you had this, the George Floyd and everything that happened there at the
Absolutely.
same time, right? And I
Yeah.
think that together, and this, the systemic racism that we're seeing, which also impacts health equity, that
Mhm.
together just highlighted that there's such an important need to take action. And I think there was no way around it. There was no way
Yeah.
around it, and it prompted a lot of organizations to do something. And one of the things that we always say is, healthcare is a team sport. It is
It is.
great that a lot of companies are stepping up and dedicating, dollars and people and other resources to this, but we can't do it alone, right? We need to do this, um, you know, as a team sport. We need to combine and make a fist with a lot of companies together to really have an impact, because it is a big challenge. Health inequity has been there for a long time. One initiative or one company is not going to move the needle. We need, many companies coming together and working on this problem together.
Yeah, I couldn't agree more. And I would say that you're right, Ruth. It's not just one company, but I think it's not one function, or it's not one group. I think we have to go to the community. We have to go to the
Yeah,
churches, the fraternities, the sororities, the government, civil service. All of that needs
completely
to
agree.
participate. Because is it that the person has an appointment? Patient Mrs. Jones, Mr. Jones has an appointment, but there's no way to get to the appointment. The buses don't run in that particular part of town, or
Exactly.
it's a really rainy or snowy day, so there's no way to get there. Could it be solved with a van service? I don't know. But these are the types of things. The infrastructure even sometimes prevents people from getting access to what is there, but they just can't get to it. And that's not always, but certainly something to consider.
Absolutely.
Absolutely. And, I love this idea of teamwork and being a team sport. Like, and if we focus for just a minute, on, let's say, the example of clinical trials, right? One of the things that I have been very vocal about is that oftentimes when we talk about research, we talk about lack of participation, right? Which puts the onus on the patient, right? It's their fault they're not participating. When in fact, there are many institutional barriers, right? There is, maybe doctors aren't asking them to be involved. Maybe they don't know where to get involved. Things like transportation issues, socioeconomic status. If you're an hourly worker, you can't necessarily take a full day off of work to do medicine for a trial and do MRIs and do all these tests, right? So we have to look at things from a broader lens, right? Instead of just saying the patient is not compliant, the patient doesn't want to do this, and look at how we can solve some of these larger barriers, or how we can break down some of these barriers so that people can have equal access.
Absolutely. Yeah. And you got to wonder then, where does the conversation begin?
Right.
And I've been asked, and Ruth, I'm sure you've been asked, and I'm sure you've been asked, why now? Why did George Floyd's murder, his death on tape, stop the world when we've seen it before? We saw it with Eric Gardner. He was choked to death, by the police on camera, on film, but the world didn't stop. So I think, to Ruth's earlier point, it was the fact that we were in lockdown and had to focus. We had nowhere to run. There were no sports, no television, no movies. We couldn't distract ourselves, what was going on. So it did put a spotlight on something very ugly that had been there all along. And then from there, well, what else? And part of it then with COVID, of course, adding to it, the health inequity. Not only do you get it more, but you don't have access to treatment. Do you want to get the treatments? Do you trust? Everything came up. How many times did you hear Tuskegee experiment come back?
Yes.
Many,
Yeah.
many.
Yeah.
And it's really interesting because, there's this study, when I first started doing talks about health equity, I always talked about Tuskegee, I always talked about mistrust, but there's actually a study that was done called the Tuskegee Legacy Project. And they asked like maybe 1,000 people, is Tuskegee the reason you don't want to participate in research? And most people didn't even know what it was. Even if I go give a talk, I'm like, what's Tuskegee? And everyone's like, well, they gave people syphilis. I'm like, well, they didn't give the people syphilis. They got syphilis the way that people get syphilis, right? And so, there's some, so that's a part of it, but that's not the whole thing, right? It's just kind of underlying pervasive, mistrust, not only from past experiences, but also from current experiences, right?
Absolutely.
People go to
Yes.
the doctor, they're not believed, right? Their symptoms are not believed. I have countless MS patients that come in and say, nobody believed me when I went in, or other patients. So, it's not just past, it's also current experience that's informing some of this as well.
No, you're absolutely right. I mean, look, Tuskegee often gets, brought up even in the media, right? And I do think that events like that in the past has resulted to some extent to that overarching feeling of mistrust when it comes to healthcare, period, right? But if you look at the disproportionate amount of Black mothers who die in childbirth or have complications, or or even my own experience with healthcare, where you see that impact. So current experiences are only feeding to that feeling of mistrust. We also don't necessarily have good representation, right? If you go to a doctor that looks like you versus a doctor that doesn't look like you, sometimes that helps, right? So we need enough representation also within the medical field, and with the scientists and whatnot, to also build on that trust issue, because I think trust is one of the biggest factors why people are not willing to sign up for clinical trials or are not willing to take the vaccine. Even though they may not be able to articulate a good enough reason why, it all starts with trust.
Totally agree.
Definitely.
Totally agree.
Definitely.
I mean, it's experiment. I'm not a test animal. You'll hear is this proved? Even with the vaccines, as we were all hopeful and begging, most of us anyway, and it's emergency use authorization. It's not approved. So that was part of the argument by some. But to your point, how do I know what you are doing is for the best for me when you haven't done anything else that's been the best for me? I mean, that's an extreme comment. Don't get me wrong. It's not everyone, but it's part of the problem. And one other thing, though, on the brighter side, which I think some of this in terms of allies comes up and things like that, is that conversations started. And sometimes they were awkward and they were uncomfortable, and that's a good thing, because it forced issues and conversations that wouldn't have happened otherwise. And as you know, unless you say or admit that there's a problem, you'll never have insight into it, and there'll never be a solution.
Absolutely. There's a comment on the bottom of my email that says the man who conceals his disease can never be cured, right?
There we go.
And so there's been this big issue about, bias and racism in medicine, and people, call it unconscious bias. And are you really unconscious and all of that? But I think that, as I said, all of these situations collided and allowed many open conversations that we may not have had otherwise. And so when we think about health equity, right, again, one of the things I like to emphasize is that it takes everybody in their own sphere, me as a physician, making sure that I'm open and that I believe people when they, tell me they're having issues, so that we can find the best treatment and working with them. How do we approach health equity in a broader sense, right? So in your spheres of influence, how do we work on health equity, or how do you perceive changes that could be made where you are in your sphere of influence?
I'm going to check on the lights, and I'll let Ruth start first. Right there. Okay.
I was about to send you some candles. No. Well, I mean, I can tell you the journey that we went through as Quest, right? Because we felt that we needed to do something, but we didn't really know what that looks like, right? So we literally pulled a group of people together and said, you know what, after hours, let's just kind of figure out what we as Quest can influence. And we put together an initial, a straw man strategy and took it to the leadership team. And the leadership team immediately said, yes, absolutely, we need to do this. But our CEO also said, I cannot expect you guys to do this on top of your day job. We need a fully dedicated team for this, right? And I can tell you, some people almost virtually fell off their chair when he said that, but he was right, because if you want to do this and if you want to do this right, you need people fully focused on this.
Right.
You don't just need resources in terms of money, but you also need people who are fully focused on this initiative. And what we also quickly realized is that you also need experts in health equity, as well as people who know the business, who are who can build something out of nothing, because we had never done something like this before. So we have a great group of talented individuals that have been working really hard for the past year to put a good strategy together, but also build relationships with external parties, because like I said, it's a team sport, to bring much needed initiatives into the market. And I can highlight one initiative, Choose Healthy Life initiative, that we're doing together with the United Way of New York City and Deborah Fraser House and the Black clergy. Because I think, Kirk, you made the point earlier, it starts with trust. The Black clergy is a trusted voice within, the Black community. So
Absolutely.
we partnered with United Way, with Deborah Fraser House, and with the Black clergy to bring much needed testing to, 5 communities or 5 cities. That's the initial start, where we offered our services and our help to bring the testing to our communities, because what we saw is that a majority of the African American patients didn't get their first test until they ended up in the hospital, and then it was too late to give them the monoclonal antibodies, right? And so that initiative has morphed now into bigger initiatives, and of course focus on vaccinations and other things. But it is just one of many initiatives that this team has started and will continue on to bring services, education, and awareness to the Black and Brown communities to influence, their health and wellness.
Yeah.
Absolutely. So it sounds like a group of folks got together, right? Like, hey, we need to work on this.
We need to do something. Yes.
Right. We need to do something, right? So you have to have folks who take that initiative and say, listen, there's something we need to do. And I've had conversations with both of you around this. My journey to health equity has been totally non-traditional, right? So I was working a great 9 to 5, 5 days a week. And I just decided I wanted to change the world, right? I wanted to help marginalized people with MS, which led to me leaving a great job, starting my own center, starting a podcast, a foundation, all this crazy stuff that I never thought I would do, right? Because I was like, I've got to be dedicated to this, right? I can't do all of this over here and still focus on that. So, it takes people taking an initiative and then kind of taking that up the ladder, and then other people catching on, right, and becoming a part of that and getting dedicated people to work on it. So all of those are key elements for anybody who wants to make change in this space, whether you are, in the physician community, whether you are in industry, whether you are in the patient community, right? There are many patients that are out there, spreading the word, talking about their experiences and making change. All of us can be change makers. So tell us a little bit about what you've got going on, Kirk.
Yeah, I mean, so much. I mean, wow, we could talk for a whole hour just on what the change. I have to say at EMD, Serono, we created something, and actually, colleague Marie-Ange and Valerie Wright and a few others, and Adrian Dawson, I have to say the other name too, created something called the Leaders of Color. So it was created in August of 2019. Then September kicked in, and then the rest of the story. Now, what it did was it built a coalition of people of all colors, of races, ethnicities, but just a passion for how do we advance health equity leadership? How do we advance people of color in leadership positions, in acknowledgement, in a voice? And how do we have those conversations that weren't happening? And then May came and George Floyd. So the membership grew to over 600, voluntary within the organization. And I'm saying this because it became this safe space. Like, I can't tell you the number of times I heard this. It became a safe space and a haven for people to have that conversation, but also say, how do I help? How do I change? I'm a part of this. And health equity certainly became a part of it. I mean, we're a biotech pharmaceutical company, and from that, we were able to have these conversations, and some of them, I think, have things like the safe space conversations where you have allies talk, Black people talk, then you bring people together. Sounds simplistic, but it was really powerful because it gave people a chance to hear themselves, to say something without feeling judged. And that was very important. That expanded to ethnic ERGs, the Black Leaders Network and the Asian organization, as well as the Latinx organization. And I'm saying all this because the organization supported it.
Yep.
The organization gave space, as well as to women in leadership and to the Rainbow Network and other. It gave space to understanding that there is a diversity here, but the diversity gives us strength. And 2 + 2 = 5 if you recognize it. And by building and learning and listening to the people that we have internally to do this, gives our creativity and our innovation more heft. And it also takes us to a different direction, makes our products better, makes our launches better. So it's really a tremendous time. It was exhausting, to Ruth's point. I mean, there were 11 o'clock nights, midnights types of things, but it certainly helped. And I know working with you, Mitzi, and in the future, I hope, Ruth, this is how we started these types of programs, looking at special populations that have been underserved.
Yeah. And I think again, this is so good. I love everything that we're talking about, right? But I think, again, we have to recognize that everybody has a part, right? And so oftentimes when people think about pharma companies, all they think about are clinical trials and medication, right? They don't recognize that there are people that are out in the community, affecting change, that there is a lot of other work that goes on. And so, I love to highlight the amazing work that people are doing. So what are you guys excited about? So tell me, so we talked about the problem, we talked about some of this. What are you excited about? So in this time, of change, and we're having exhausting conversations, but making progress, what are you excited about in terms of progress? Like what's forward moving?
I'm just excited that the conversations are happening, right? Yes, it's a ginormous task, to move the needle, but the conversations are happening and resources are dedicated to it. And yes, we will make mistakes, but we will also make progress. And that prospect is exciting to me. And the fact that I can combine, my regular job, leading a franchise, but at the same time working with a great group of folks on doing good, for the community, that excites me. It gives everything it makes everything much more meaningful and gives it purpose. And I think that's, as exhausting as the past 18 months have been, especially from a COVID-19 and the role that the diagnostic industry has played in that, and COVID-19 testing sitting within my franchise, it's been exhausting. But the quest for health equity journey has been like, 93 gas in my car's engine. It is fueling us, and it makes us proud, and it makes us feel like we can actually drive change. And so that's what is exciting me.
Yeah. I couldn't agree more. Like you said, here it goes to the second hour of the conversation, but I have become involved in lots of different initiatives around this, but one in particular is the launch of the Augustus A. White III Institute for Health Equity. And the website is aawinstitute.org. And it celebrates, recognizes, but also honors and continues the legacy of Dr. Augustus A. White, who is the former Harvard Medical School chair, one of the chairs of orthopedic. And he was the first Black man to do that. He was one of the first, not the first, Black students at Brown University, and then the first Black medical student at Stanford Medical School, and the first Black surgical resident at Yale, and then on and on and on, and rose up through the ranks. And I say that because his battle, having grown up in the Jim Crow South of Memphis, Tennessee, was to not let that bring him down. He used it to energize him. Yes, it was painful. There's a book, Seeing Patients. I highly recommend it. To read that and how inspirational it was. How can we not take him, and he's 86 now, so he's retired, but how can we not take what he has done and then expand it to what?
Yeah.
To talk with the government people, to talk with fraternities, sororities, with the hospitals, with academic centers, with civic leaders, with financial institutions, with philanthropies, to say, how do we bring the right people together to have the conversation so that Mr. and Mrs. Jones can have the health equity, so that Mr. and Mrs. Rich can say, how can I help this? How can people come together? How can I recognize what's really needed? And how can I go to a website, or how can I go to a place and I can click on something and see me and say, gee, I have migraines. I really can't, my medicine's not working. Is there a clinical trial out there? Could you then go on this particular website and find it? Can you help and say, well, are there any programs? Are there any lectures? Are there any things happening? What's going on in the community? You go there. And what are we doing as an institute to help drive this? So it's been a lot of work getting it off the ground, but I have to say, to Ruth's point, it's a passion that you say, I have to keep going because it's too big to fail.
Yep.
And, I want to develop think tanks and partner with folks, the community medical centers, what's needed and where they come from. And you'd be surprised, I think, coupling what you, Mitzi, and Ruth said, that we're at a time now where money is there to do these things, but the interest is there.
Yeah.
And now's the time, because we don't want the door to close. We know it can, but now's the time to make something solid like that. So I'm really proud of being part of that, and other, obviously platforms and foundations that are out there.
Yeah. I think the thing that I'm most excited about is I feel, I would say, heard. For so many years, I would go to all these meetings and they say, what do we need to talk about? I'm like, minorities in MS. And I'm the only person, and everybody's like, yeah. Okay, but we really need to talk about this over here. And so it's, I guess, validating in some sense. Right. So I'm always at the end and everybody's like, yeah, okay, we'll get back to her. She always says that, she's the girl in the back waving the flag, like, we need to talk about this. Yeah. And so it's really exciting to see the work progressing, right? So we have the National African American MS Registry, which has been a dream of mine for 10 years, that finally came to fruition in September of last year. And, we got a clinical trial that's focused on Black and Hispanic people with MS. And so there's just so much exciting stuff going on, right? And I think the other thing that's important, and I remember I used to do a lot of work with the late Omar Khan, who did a lot of research focused on Black people with MS. Kirk was a part of much of that work. And one thing that he said that always stuck in my mind was to make sure that we don't make the minority a minority, right? So we now, we're focused on African Americans, we're focused on Hispanic, Latinx patients, right? And we have a lot of work to do, but let's not forget, right? Indigenous populations. Let's not forget Asian American populations where we don't have really any data, right? So we have to make sure that we are not just becoming so narrowly focused that we forget that there are other marginalized groups, particularly with MS. You think about rural populations. You also think about people over the age of 55, which I have been saying 55 is not old. Okay, it's an arbitrary number. I don't know where they came up with it from in the clinical trial.
With you.
I think it's arbitrary. Somebody
made
it up. It's not old, right? But we have to think about all of these people are excluded, right? So how do we expand our efforts to make the work that we're doing more inclusive, not just of, Black and brown people, but of other marginalized groups, within the MS community? Absolutely.
Yeah,
absolutely.
Those conversations. I know, Ruth, you want to go first? It's fine.
No, go ahead.
And it's the conversation. It takes me back to leaders of color. It takes me back to inviting people to the table. Not everyone's going to come, but providing access in a moment, which becomes a movement, right? A moment becomes a movement where these conversations can take place and people feel safe enough or feel open enough to share them. It may be uncomfortable. It may be uncomfortable. And I think it was like a confluence. I don't know, it's not a perfect storm, perfect rainbow. I don't know what you would call it, because there just came this point, to your point, where what you were saying resonated. You couldn't hide from it anymore. You couldn't say it's second, third, fourth priority. You couldn't say, oh, it's not on our, priority list of therapeutic areas. That's not it. It is the here and now, because it has impacted the world, because the injustice to one human is injustice to every human.
That's right.
And I think that health equity, but just in terms of ethics, came front and center. Certainly in 2020. It's been around forever, since the inception of this country, but still, it was like, no, we're supposed to be better than this. We're supposed to be further along than this. I've been there with you, Mitzi. You took me back to some of those moments where we're sitting there trying to design trials and say, how do we approach this? I'm saying, Ruth, I'm sure same for you. How do you move the needle? And to others in the nonprofit organization, I was saying, the A White Institute, you gotta keep going. You gotta keep fighting the fight and pressing on towards the goal.
Yeah, and I think you're so right. You got to keep going. And one of my biggest fears, we talked about what excites me, right? But one of my fears is that many companies are in this because it's the right thing to do, and it bubbled up, because of COVID, and are not in it for the long haul, right? Because I do think that this is not something that you do for a season. You do it for a reason, right? You have to stay in this to really drive sustainable change. So I think it's important that those companies and not just companies, but community-based organizations, you name it, that we all are in this for the long haul.
Yes.
Absolutely. So there has to be sustainable action, right? And so that's one of the things that, I talk about a lot whenever I'm doing advocacy work, consulting, speaking, talking about trials, et cetera, right? I've seen so many efforts where we have this momentum and it's like, yes, let's talk about it. Let's do it. And then, within, a year, people get a new job. Right. So, it happens. There's lots of turnover, right? Somebody moves from this position, somebody gets promoted, right? A doctor moves from this institution to this institution, right? And so, it has to be a part of the bones of that organization, right? It has to be kind of in the DNA of that organization for the efforts to move forward, because I've seen so many where it just kind of drops off. And then 2 or 3 years later, somebody else wants to pick it up and we start over from scratch. And then that person gets a promotion and then it drops off again, so you have to have those dedicated people who are working on it and focused on it, as you said, Ruth, but really you have to have some type of plan for sustainability. That's key to really moving the needle forward.
Yeah.
So how do we keep the momentum going forward, right? So as we're kind of coming to the close, this has been great. So as we're kind of coming to the close, right? How do we keep the momentum moving forward, or what can we do to keep the needle moving forward?
Just kicking it off, I think put something in place. I think, be it a clinical trial, be it a policy, be it an institute, be it a nonprofit, be it a conversation, be it a social group or something. Put something in place that has some legs and then get it going. Don't boil the ocean. Don't try to do it with 100 people maybe initially. But if you anchor something and you say, this is the goal, this is the objective, this is the tactic, and then you follow through, it's something you can then hold on to and build upon. I think sometimes these issues are just so big, and that's one thing we face in the Institute. This is just so big. Where do you even begin? And how do you get all of those disparate functioning groups together? I mean, people are busy, right? Another thing, and I'll let Ruth talk because I can go on forever, but that is, know your audience. What resonates with different people, right? So when you talk to a philanthropy group, or you talk to the reverend, or you talk to the fraternity or sorority, what is it that group needs to hear in order to come on board and sustain it? Right? Because not everything for everybody, right? We need to understand that. And one thing that we've seen, which is coming up more and more, which I think is fascinating when you really think about it, is generational diversity.
Yes.
Meaning, I think there's articles like there are 3 and 4 generations working in the same company on the same workplace right now. So in my generation, you would never think of going up and saying, I think I deserve a raise right now. I think I'm that good and I'm that. But then, you have other generation X, Y, and Z that says, well, no, I've worked a certain amount of time and I deserve it, and good for them. but it's just a different approach, you know.
Mm-hmm.
And there is the concept of participation trophies, right? In my day, you won a
Mm-hmm.
trophy because you won, you
Right.
know. Now there's participation trophies, which have its merits, but it's not necessarily because you won. Bring those two worlds together, and you can have a problem. So I think, you know, you need to, I need to, I think we all need to understand the audience and who we're dealing with in order to make the good ideas stick.
Right.
Yeah, absolutely. I think the other part, I mean, the way we look at it, you know, in the initiatives that we're doing is we can't boil the ocean. Like we can't do everything everywhere and really be successful. So we really need to look at what are the communities where the need is the highest, right? And looking at all social determinants of health. And then decide, okay, you know what, in certain communities, we're going to go deep. And here's where we're going to, you know, build the partnership and go deep and drive change rather than say, you know what, let's sprinkle it all across the country, because you're not going to be able to drive change that way, you know. So it's you really have to be deliberate and focused in how you approach this and who you're partnering with, to make it sustainable and to drive change, you know, one community at a time.
Mm.
Absolutely.
I love that. I love that. Deliberate, focused, and making sure that we're collaborating between the different groups that we have. One of the
Mhm.
things that I talk to everyone about is that everybody can make change where they are, right?
Mhm.
Whether you are a person living with MS who wants to share your experience so that it can help other people, whether you are a support group leader, who wants to inspire other people, whether you are an advocate who wants to speak out about certain injustices, whether you're a physician, whether you are, working in industry, there's a way for all of us to make a change. And so we all have to
Mhm.
kind of look at our sphere of influence and see where we can be deliberate and where we can make changes. And I'm really excited because I see a lot of people doing that, right? And I
Yeah.
see the
Mhm.
change happening, and it's extremely exciting and encouraging, that people are being the change that they want to see. And so I can't
Yeah.
wait to see what the next steps are. So, what we'll do is I'll give a few seconds. If anyone has any questions, they can put them in the chat. Um, which I'm very, so we'll take a few seconds. If there are any questions, you guys feel free to put those in the chat before we wrap up. But this has been an amazing conversation. You guys know I could talk about this in my free time. Like I can have this conversation not on a podcast, like just on the phone with
Yeah.
either one of you or any of my friends, because I'm so passionate about this work. But I love the fact that there's progress being made and that people are really
Mhm.
paying attention to this area and trying
Yeah.
to improve some of the disparate outcomes that we're seeing.
Yeah, and you are
Yeah.
a major part of that change. I mean, I know Ruth and I try our
Oh,
best, but just knowing what you've done and just having this podcast, but also keeping it fresh, keeping it in the spotlight, and
yeah.
saying that it is.
Absolutely.
I mean, for years, we were taught Black folks, Hispanics don't get MS. We know not
Mhm.
only do they get it, but it's usually more severe. So they
Yeah,
would
Yeah.
benefit
exactly.
from faster and more efficacious therapy up front.
Yeah.
Yeah.
That's a paradigm shift for a lot of people.
It is. It is, but listen, I will go around and wave the flag and,
Mhm.
spread the gospel wherever I need to go. So I will keep waving the flag as long as I need to wave the flag until I get hoarse and I can't talk anymore, because this is just
Yeah.
that important. It's that important, right?
It
And I'm
is.
that passionate about it. So
Yeah.
but anyway, so it looks like we're coming to the close. Any last words of advice you would give to folks, who are looking to see what they can do to make a difference in the health equity space?
Let Ruth go.
Kirk. Oh, all right. I was just about to say I'll let you go. Look, be the change, right? We all can play a role. Whether it's educating people in your community about the vaccines, since we're still in the COVID pandemic, or working with community centers or local companies that are trying to drive change within the community that you live. I think we all can be part of that change, um, whether it's within the company that you work or outside of that. And there's power in numbers. Um, that's it.
Yeah.
Absolutely.
No, I'm totally with you. And mine's like sort of two things. Don't be quiet. I mean, change can be just speaking up and saying, "Hey, why did you do that?" Asking the question to someone who you saw do something offensive. If you see something, say something. You have to punch the person. You don't have to curse the person. You can ask the person, say, "Hey, why did you just do or say that?" To say what, draw it out. The other thing is another sort of cliche, but it's true. On the plane, put the oxygen mask on the parent and then the child. You have to take 5 minutes for yourself when you're doing this type of work. Just 5 minutes, whatever, but you have to take time to recharge your batteries because it's exhausting. You're human and you feel and you have pain and you emotion, and it can be draining you, and then you leave nothing on the table. There's nothing left, and that's not good. So I think for all three of us, for me, speaking for myself, I have to take 5 minutes, and I think it's important because then you come back refreshed and ready for the next battle.
Absolutely. You can't give from an empty tank. If your tank is
That's
empty,
it.
there's nothing else you can give to other people. So,
That's right.
well, this has been an amazing conversation. And I am so appreciative of you all taking time out of your busy schedules just to kind of talk about this and talk with our audience. This work is so important. And as I said, it takes a team, it takes all of us to make it work. And I'm really excited and proud of all the amazing work that you guys are doing. So with that being said, we will close out our brain chat, our post Labor Day brain chat, and meet us in 2 weeks. Same bat time, same bat channel. And we will be talking about advocacy with some of our folks from across the pond. Thank you so much to Ruth Clements and to Dr. Kirk Taylor for joining us tonight. And we will see you next time on Brain Chat. Have a great one.
Thank you very much. Thank you,
Bye,
Mitzi.
guys.
Have a great night. See you later, Ruth.